Hey everyone, just a brief lecture on good communication and documentation in healthcare and its importance. And hopefully this little cartoon here is a good illustration to you of the importance of good communication. People don't communicate well, people can get hurt. So communication, as the cliche goes, is a two-way street. There is a message sender and a message receiver. And the message receiver often has to give feedback to the sender, so it's a continuous loop, really. How many times have you been talking to someone and they totally misunderstand what you are saying? All right, and maybe you get upset and frustrated because they're not understanding the message that you're trying to send, but perhaps it's you, the sender, that's not doing a great job of clearly portraying the message. So it's really this two-way street that both parties have to be sort of on the same page. And doing that sometimes is harder than it seems. And we think of communication a lot in terms of talking with someone, but communication is really, it's an exchange of information, and there are many ways to exchange information. And the three main ways we do it as people are verbally, non-verbally, and through writing or written language. So when it comes to verbal communication, I have some tips for you for successful verbal communication, whether this is with a coworker, a patient, an authority figure, a spouse, a friend, a family member, right? The first thing is to make sure you're using proper language. And knowing the proper language to use depends on your audience. So you really need to know, like rule number one, I guess, of communication is know your audience. If you're communicating with another health professional, you can use technical medical terms. But if you're talking to a patient, they may not understand those same words, and you may need to use different vocabulary. But if you simplify things too much and sort of dumb it down, then they might think that you're being belittling or patronizing. So sometimes it can take some real soft skills. It's a real art form. So using the right language in the right situations is important. Another one is manner and tone. Always be polite and respectful. Be calm and collected when you're communicating with people. Try to reflect the type of communication you want to see from others. So try to keep anger, frustration, derision, impatience, any other negative feelings out of your professional communications, written as well. So sometimes this means you might need to take a deep breath, or go outside for a minute, or go vent to someone on the phone before responding to someone in person or replying to an email in written communication. Competence is important. You should speak to what you know. If you don't know the answer to something, then say you don't know. Don't try to come up with an answer that sounds interesting or intelligent if you don't actually know what you're talking about. It's okay to say, I don't know, let me find out. In fact, that's oftentimes the more respectable answer. Verbal encouragement, especially when working with patients in a healthcare setting and trying to get information from them, like clinically relevant information. Sometimes they can be very short, have very short responses. And so giving them encouragement to go on, like yes, and what else? Things that encourage them to share. Humor is something that has to be used in moderation in healthcare. Again, it's a kind of a know your audience situation. Humor can be used in a sensitive and respectful way to ease tension or ease anxiety, and that's a great way to use humor, but it can also be used inappropriately, and it's important not to cross that line into inappropriate circumstances or any inappropriate types of humor. Another thing that's important in a kind of related to manner and tone is the level of assertion. So you don't want to be passive in your communication. You don't want to be non-assertive and passive. Things like, mumbling or saying, I don't know. because that tone and type of language is often ineffective at getting points across, at getting things done, and they display a lack of confidence and competence in the person who is doing the communicating. So the key is to be assertive, but not aggressive. So assertive language gives the impression of confidence and humility, while aggressive language is more combative, argumentative. It can be perceived as rude or insubordinate. And the line between the two can be really fuzzy. So these are some good examples to read through, the difference between assertive and non-assertive language. And then you could imagine something that's aggressive is more argumentative. And so you want to portray confidence without portraying aggressiveness. Another good tip for verbal communication with patients, with colleagues, with friends, family, is being a good active listener. So active listening means that you are giving your full undivided attention to the person you are listening to. And ways you can do that are to make good eye contact, and to not check your watch or your phone or look around the room. Really show that you're listening, nod along, engage, but don't interrupt the other person. And also, another important part of active listening is paying attention not just to the words they're saying, but to the nonverbal cues that they are giving you. And that brings us to the next type of communication, nonverbal communication. Nonverbal communication is actually a major way that we communicate. So we think of communication as the words that we are saying or the words that we are writing to someone. But the words really convey a very small amount of the message. A big part of the message are our nonverbal cues. Whether, what are our eyes doing? What does our posture say? Are our arms crossed or are they not? What about the tone of our voice? Or the volume or the emotion behind it? Are you saying bye, like you're really happy to see the person go and you're mad at them? Or are you saying bye, like you're really sad to see them leave? So there's, different tones can change a single word into having different meanings. So nonverbal communication is something we have to be attuned to when we are listening to someone, so that we can make sure that we get their full message that they're sending. But we also have to be aware of the nonverbal communication that we are sending, making sure that we're not unintentionally sending nonverbal communication that we don't want to. So one very key part of nonverbal communication is facial expressions and other body expressions. We call this kinesics, or body movement is what that word means. So gestures, your stance, if your arms are crossed versus if they're relaxed. So think about what these different facial expressions here on this slide are communicating to you. All right? And imagine that you are drawing blood from a patient for a blood test. And she starts to lose color and turn a little gray. I'm describing myself here. So you ask her how she's feeling, and she says she feels fine. But it's your job to read her nonverbal cues, because you could question her further, ask her if she would like to lay down, or just flat out tell her to lay down if she looks like she's going to pass out. I have been that patient who was on the verge of passing out but said, "Oh no, I'm fine." And the nurse believed me, and then I stood up and fainted. So definitely take into account those nonverbal cues that might even be contradicting the patient's verbal communication. Another thing about nonverbal communication is that it can involve touch. Touch, like humor, can be used in the right circumstances in the right way, but can also cross a line. So touch can create either positive or negative feelings. And it also, again, kind of comes to knowing your audience. Sometimes you can't know whether the touch will be well received or not. So watch for nonverbal cues that show how the patient feels about being touched. Maybe one patient grabbing their hand and giving their hand a squeeze makes them smile, and you can tell that that was a comforting touch. But maybe another patient, you try to hold their hand and they pull it away, or they flinch, or they tense. And that would be a sign that that patient is uncomfortable with that touch. Now for written communication tips. When you are writing, whether it's a patient chart or a personal email or a professional email, you always want to be careful in your writing, knowing that it can be used against you. So written communication is tangible. There's a record of it. So you might say something wrong and people forget about it, but with written communication, like emails in particular and patient records, those are permanent documents that can be rehashed and used against you. So you definitely want to be very careful about what you put in writing. And this also includes social media. Those are public accounts that can be accessed. So you really have to be careful about what you put out in the written world. Because it's something that can always be dug up and potentially used against you. So just, that's my, be very cautious. When you are writing in a patient record or professional communication, you always want to make sure that you are clear and concise, to the point, and make sure that you use proper grammar and spelling. There's nothing that makes you look less intelligent than improper grammar and spelling. So even after college, even in text messages and email communication, and especially during college, start practicing that now, making sure that you are using proper grammar and spelling in all of your writing assignments and your emails to your instructors. So that you can demonstrate that you know those things. Excuse me. So when you are communicating with patients, you may do patient interviews, which is when you'll learn about the patient's medical histories and the symptoms they're experiencing. It's sort of like gathering clues to solve a mystery. The mystery being whatever their present illness is. And if you don't interview them thoroughly, or they don't feel comfortable communicating with you, you might miss important clues that you need in order to get the correct diagnosis. So using all of these good communication skills is really important to be able to get the information you need from the patient and communicate it to their other healthcare providers. So listening actively and asking appropriate questions is part of your sort of clue gathering, and then recording that information accurately will be important for the next healthcare provider who's coming in, whether it be the doctor or a radiologist or a specialist who needs to add to those clues in order to get to the correct diagnosis. And it's also really important to communicate with the patient about what is going on. So if you are doing a patient in an intake interview of the patient, and then it's time for you to leave the room and the doctor will come in later, let the patient know that, so-and-so will be in a few minutes. If you need to take their blood pressure, let them know before you touch them that that's what you are about to do. Always giving patients information, all the information that they need pertinent to their health care, and don't take for granted that they may not know that that's what the blood pressure cuff in your hand is for. So if they are looking anxious, even though you take somebody's blood pressure 100 times a day, they may have never had that done before and may be frightened. So just making sure that you clearly communicate everything with patients is really good for establishing trust and getting them to communicate openly back. Another important thing with communicating with patients, some different interview techniques during these patient interviews. One thing is called reflecting. So this is where you use open-ended statements to repeat back what you've heard. So if the patient says, well, I've been having a pain in my knees when I walk, then you would reflect by saying, okay, so your knees are painful when you walk. You're just reflecting back, and you're kind of leaving that statement open at the end for them to fill in or continue to elaborate. Paraphrasing is using your own words to repeat what you've heard. So this is almost more like summarizing, maybe after the patient has explained everything, or maybe uses a really long story to explain something, and you sort of paraphrase it into 1 or 2 sentences. Clarification is when asking for an example or further details. So maybe the patient who has pain when walking, you might say, do your knees hurt when you're doing any other activities? Or does any other part of your leg or body hurt when you walk? For further clarification. Open-ended questioning is asking very broad questions like, when did this start? How did that happen? What are you here about today? And those are very open-ended, allows the patient to think of maybe other things that they forgot, and doesn't lead them into a conversational corner, if you will, by asking when you ask specific questions. Summarizing, sort of similar to paraphrasing. Summarizing is when you review everything that you've heard in a very condensed form. And then silences are also useful. So silence, a lot of us feel very awkward about silence, and we feel the need to fill it, right? So as the interviewer, you might feel uncomfortable with the silence and feel a need to ask more questions to fill it. But if you just sit with the silence, the patient oftentimes will fill it, will offer more information. So don't be afraid when you're actively listening to someone to respond with silence. Maybe a facial expression, a welcoming facial expression, a nod, like you understand what they're saying, or a questioning look, like maybe you want to know more, and maybe communicate with your face and not with your mouth, and give patients time if they're trying to articulate something, get their thoughts in order. Don't try to put words in their mouth, just patiently wait for them to explain it in their own words. So these are all really good interview techniques to get a really good, complete response from someone regarding anything really, but including their, illness, whatever it is that they are a patient of. Another important role of healthcare workers, particularly nurses, doctors, dentists, is in patient education. So you're not just necessarily acquiring information to make a diagnosis or making the diagnosis, you're also conveying that information to the patient. So communication with patients is not just to get information from them, but to give information to them. So a major role of various healthcare professionals is to educate patients about their diagnoses or about their treatment plans. So for example, a patient might be diagnosed with asthma and prescribed different medications. It's important that they understand when and how to use the different medications. For example, inhalers are really just for emergency use, and they're often used improperly, either physically, like the patient uses it more like a breath freshener rather than actually inhaling it, or they are used improperly by frequency, where they're really not supposed to be for daily use, but really for when experiencing an actual asthma attack. And so many patients require that education, and a lot of times they require repeated education. So maintaining your patience in repeatedly having to give the same lesson over and over again, sometimes with the same patient. And it's always good practice to provide lots of positive reinforcement. Let them know what areas they're doing a good job so that they don't always feel like maybe they're being criticized. Um, Another important aspect when it comes to patient education, these sort of are these steps: assess, plan, implement, evaluate, and document. So the first step is to collect information, assessing a patient. So like, let's say we have a new mom. So assessing the patient might involve asking questions like, are you breastfeeding your baby? Are you experiencing any problems with breastfeeding? And maybe the mom is, maybe she isn't. So then you establish a plan. You make goals about how often to feed the baby, how to feed the baby, how to supplement the baby's feed. Maybe the baby needs to eat every 3 hours, or maybe it needs to be more frequent or less frequent. Maybe we need to supplement with formula, maybe not. Whatever it is, we make that plan. You make that plan with the patient. And then you implement that plan by giving them training for it. So maybe you give them some handouts to educate the mother about breastfeeding and formula feeding, and maybe different diagrams for how to position the baby or position the nipple when breastfeeding. So instructional information, or information about different formulas and how to prepare them. Then you do evaluation, which is you check back with the patient, determine how well they're doing with everything that was discussed. How is feeding going? Are you having any problems? What are they? And you may need to do, repeat this process, do more assessing, planning, and implementing. Throughout all of it, though, you need to document. You need to document and take note of everything that you've talked about with the patient, all the conversations, what you told them, what their responses were. In most healthcare professions, what you will find, and especially in your interview assignments, is that a lot of time is spent on paperwork, on documenting. If you didn't document it, it didn't happen. And so documentation is super duper important. And that's the other part of this lecture. So other communication challenges that might come up is your vocabulary being unfamiliar to a patient if you're using medical terminology and they don't understand. Distractions can become communication challenges. If someone you're trying to communicate with is distracted, maybe they're distracted by pain, or maybe they're very hungry, or maybe the environment is too noisy and you think you are clearly communicating something, but the message is not being received because the receiver is distracted. Language barriers often present themselves in healthcare situations. People who speak different languages or non-native language speakers, and maybe don't understand everything that's being communicated because they don't have a great grasp of the language that's being spoken, and maybe there's not a translator around. But if somebody seems like they need a translator, do the best you can to get that. Try to assess whether it is they are actually understanding, or if they need an interpreter or interpreting program. Hearing impairment can get in the way. My dad is definitely losing his hearing. He's got hearing aids. So many times we have to repeat what we say to him because he doesn't really hear, and it's obvious because he'll respond to, he pretends like he heard, but then his response to whatever we said is just it's not appropriate. He obviously didn't hear what we said. So again, paying attention to the receiver and the cues that they're sending out can tell you whether or not maybe they have hearing impairment, because it's not always something people would admit to. Sometimes people you're communicating with have a cognitive impairment, and so the content of your message is not getting through, not getting properly processed. And sometimes emotions get in the way of communication, whether it's the emotions of the sender or the receiver. But anger or grief or stress, all of those things can get in the way of effective communication. So a challenge for you is to try to think of ways that you could overcome these in those situations. Try to minimize distractions if you notice them. Take someone to a quieter location, or offer them something to eat or drink if they are very hungry. If there's a language barrier, getting an interpreter, or maybe even finding some kind of interpreter software or app that you could use in a pinch. All of those things will go a long way to improving communication. When it comes to telephone communication, this generation, I mean, myself included, even an 80s baby, have not spent a ton of time on the telephone. A lot of communication now is done over email and even text messaging. And so young people today sometimes get their first job and haven't really had much experience with answering phones. So it's important to, when you're in a professional setting, to answer the phone professionally. So don't just hello. You need to identify yourself and your office to the caller. So an example would be to answer the phone and say, "Hello, Dr. Pepper's office. This is Sarah speaking," as opposed to just saying hello. And another really good tip is to say it with a smile. When you speak with a smile, you actually sound more cheerful. So it's a great way to infuse your voice with a cheerful, welcoming, friendly tone. They say never put a caller on hold immediately after answering the phone, but a lot of times in a busy setting like a hospital, that may be necessary. So, do it if you need to, but don't do it unnecessarily. And now for medical, so that's everything about communication. So we said that it's really important with communication. Everything you communicate needs to be documented. So medical documentation is really important. And it is protected information. So it includes everything that the patient has communicated with the doctor, nurses, specialists, and it has to be filed carefully and confidentially. The medical record can include insurance forms, it can include personal health information, personal identification and address and social security numbers. All kinds of stuff go into the medical record. And because of that, medical records are legal documents. And they have many purposes. So the medical record sort of serves as a central document that communicates with all sorts of health providers. So the hospital, whether the patient is inpatient or outpatient, if they're getting referred to specialists, notes go in the medical record that then the specialists read. If tests like blood tests or lab tests are being ordered, those notes need, there's communication to and from the laboratory into the medical record. If drugs end up being ordered or prescriptions are ordered, those get sent to the pharmacy, and then the pharmacy lets the doctor know if the prescriptions were filled. If there are special radiology requests sent to billing and insurance companies, the medical record is coded by the billing office to send the bill to the insurance company to get reimbursed. So all kinds of individuals are in on this medical document and use it as a central sort of source, a primary source to communicate about an individual patient. So it's important that everything is clear so that the continuity of care for the patient is not disrupted. So documentation is important for communication between healthcare providers about a certain patient. It's also important for assessment. All of those different healthcare providers weighing in, they need all those clues, right? So the health record is a place to document all of these clues so that providers who are trying to come up with diagnoses can do that. So some important things, some important assessments that you find in the medical record are things like vital signs, respiration rate, blood pressure, pulse, body temperature, various circumstances around the patient's visit, symptoms the patient may be experiencing, their medical history, their social history, etc. Documentation is also important for assuring quality of care. So hospitals and doctors' offices regularly undergo medical record audits where there are teams that come in and they pick some random health files to audit, they look at all the notes that were taken, at the diagnoses that were made, to ensure that doctors are making correct diagnoses of patients and that they're doing it in a timely fashion. If doctors are misinterpreting patient lab tests and giving them the wrong diagnoses, you would want to know that if your doctor was not doing a good job or providing quality care. So it just ensures that providers are competent, that they're providing quality care. And something like, I took this from a healthcare audit company's page, that apparently 32% of medical records contain unsubstantiated diagnoses, where like maybe a doctor just did a physical exam and said, you have this disease, but maybe didn't do enough tests to really confirm that a patient had that disease, and maybe didn't have that disease after all. So it's sort of, it ensures good medical documentation, also kind of ensures that health providers are giving good care. Documentation is important for reimbursement. For insurance companies, the medical records go to the billing office. The billing office codes the different procedures or lab tests or exams that were done and bills it to the insurance company so that the hospital or doctor's office can be reimbursed, and so that the patient's health coverage can be covered so they don't have to pay out of pocket. So verification of care that is provided so that reimbursement can be made is a big part of the purpose of documentation. Medical records are legal records. They are legal documents. They are admissible as evidence in court proceedings, particularly in cases of abuse. They are useful in defending against charges of improper care or malpractice, so they can be sort of CYA, cover your ass, for providers to make sure they're evidence that they did provide good care, even if a patient is trying to sue them for not. And it's also needed if a patient is making an accident or injury claim, like workers' comp, or a car accident, like they're making a claim against insurance or the other driver's insurance. And another really important role of documentation is for education. Medical records can be used as case studies. They can be used in research to do like broad case studies that are published research. They can also be used in seminars to help train new people, especially new doctors. So a very common practice in hospitals is these morbidity and mortality conferences that often happen on a weekly or monthly basis, and they involve peer review of cases that had poor outcomes in an effort to learn from the mistakes that were made so that they aren't made in the future. In order to improve patient care in the future, basically doctors gathering around, looking at a case that didn't go well, and asking, what could we have done differently? What should we do differently in the future to make sure that this doesn't happen again? And also documentation can be used in research. So I said, kind of lump that in with education, but data from medical records can be used to determine things like similarities in disease presentations. A lot of data from even COVID-19 disease has come from medical records, comparing medical records of patients who've reported with COVID-19. And a lot of what we have learned in the medical setting has come from good, accurate documentation of patient care and what worked and what didn't work. So effectiveness of different therapies. For example, one really effective therapy with COVID patients was simply turning them on their stomachs in a prone position that they were able to breathe better. And sometimes saved patients from needing to go on a ventilator. And that therapy was not discovered in like a clinical trial. It was discovered in practice by scouring through medical records and finding a trend that was an effective therapy. So when it comes to medical records, sometimes they are physically written, which is kind of old school, though there's still a lot of doctor's offices. My dentist's office still has physical copies, but more and more we're moving towards electronic medical records. So there's pros and cons to each. The advantages of the electronic medical record is that it's very easy to use and easy to access the data across multiple places at one time. So when you have a physical copy of a patient's record and they need to, maybe have some labs drawn, or they have to, or maybe they're transferring to a different doctor's office, or they're going to see a specialist, then that record has to be physically faxed over or photocopied to be shared with the other providers, right? Where electronic medical records can be accessed, immediately via the internet on a provider's computer with, say, a password. The downside of that is then it can leave it security-wise susceptible to sort of hacking or information leaks or data leaks. So it can sometimes be a less secure form of access. It's easy to store. So physical medical records take up a lot of physical space, like whole rooms dedicated to storing files, and then maybe even more rooms to store backup files. Whereas data on a computer takes up very little space. You can store a lot of medical records in a very small amount of space. So that's great. It frees up a lot of physical space. It's easy to back up electronic files versus physical files where you would have to make physical copies. Electronic records can improve legibility when you're typing in answers. When you're typing in, it avoids some of the problems of legibility of different people's handwritings. And it's oftentimes faster because it can be made automated. Different sort of, drop-down menus or check boxes for faster filling out of forms. So electronic medical records definitely have advantages. They also have some downsides, like, being dependent on power. If power outages, or if there's, a corruption of the software, all right, then that can really handicap providers' ability to provide care, because if they can't access the patient record or record in it, then they are kind of high and dry. So computerized documentation with all medical records, we do have to make sure that we keep them protected. HIPAA guidelines. So when you are working on a computer, you want to make sure to back things up regularly, to not let people have access to it who should not have access to it. Don't leave it up on your screen. Don't share passwords. Don't leave your computer unattended. Make sure that when you're sending emails that they are encrypted and that you're not sending protected health information over emails. Some different things, different forms you might find in a patient record. An admission sheet. This is information that's gathered when the patient is first admitted to the hospital, and has some basic data, maybe some vitals, demographic, insurance information. The graphic sheet is recording of all of the vitals, and it might have a history of the patient vital signs over time. And these are great because they help to show trends in patient weight, pulse, temperature, blood pressure, and if those are changing drastically or they go through a sudden change, that can be a sign that something is wrong, and providers can quickly spot those changes and trends. Sometimes they're paper versions, manually done, and sometimes they are computer generated. Nowadays, mostly computer generated. Other things in the patient record: physician's orders, so orders for tests, for x-rays, for follow-up visits, for pharmacy prescriptions, etc. There also, you would find progress notes. So anytime the patient calls in or emails the doctor and is reporting any developments over the phone, any communication, sort of even these sort of in progress notes sometimes involve a lot of informal communications or check-ins. The medical history of the patient, so their history of different medical procedures they've had, diseases they've had, medications they're on, allergies, any family history of diseases, particularly ones that are genetic and run in families. Social history, things like marital status, their lifestyle, hobbies, whether they drink alcohol or smoke tobacco. All of these things can affect their illnesses, but also their illnesses can affect their lifestyle. And if their medical diagnosis is going to have effect on their occupation or their hobby. For example, my stepmom is a runner. She is an avid runner. So if she has a leg injury, she's not going to take well if a doctor says, well, you just need to rest for 3 months and not walk on it and not exercise. A good doctor for her is one who understands that her hobby of running is very important to her and will work with her and work around her diagnoses so that she can enjoy her hobbies still, and so having an understanding and respect for these other things going on in the patient's life, a holistic view of the patient, provides a holistic view of the patient and allows you to treat them holistically as well. Various exam sheets, so results of a physical exam, results of different tests that might be performed, whether it be like an EKG, echocardiogram, blood tests, x-rays, CT scans, all of those things get put into the patient record. And then there might be other miscellaneous documentation, like maybe signed HIPAA forms or organ donation forms or a living will, end-of-life decision forms like a DNR, like a do not resuscitate. So there are other legal types of forms that might be found there. So it's really important when documenting things in a medical record that you are accurate. You include only facts, not opinions, but facts. You don't say the patient had a fever. You say the patient had a temperature of 102. Because a fever, we need to know the severity of the fever. We don't need to know, general things like fever. We want specificness, okay? So you want to be complete when you are discussing different tests that you've done. Or, for example, for vital signs, if you take their blood pressure and their blood pressure is normal, you need to record that it's normal. So you don't just record things that are abnormal. You want to record normal and abnormal signs. You want to be concise, only give relevant information. We're not writing a book here. Nobody has time to read through a book of information. You want it to be as brief, but also provide as much detail and in fact as possible. And of course, you want it to be readable. You want to write legibly if you're writing by hand, so that you can so that people can understand it when they read it and they don't make mistakes or miscalculations. There are different ways to organize medical records, so sort of in how they're arranged. Some medical records are organized in a problem-oriented format and some are in a source-oriented format. So problem-oriented format organizes information based on the problem reported. So like, let's say you come in with back pain. So all of the appointments and tests that are related to your back pain will be in one section. But then the next time you come in, you have diarrhea. And so all the tests and everything that's associated with that diarrhea will be in one section. So it's organized by the problem that it's, that is related to. Sometimes they're source-oriented, so they are organized by, all the physical exams are in one section, all the x-rays are in another section, all blood work is in another section, so it's organized by, sort of the type of document, not so much by the problem it's addressing. In the problem-oriented medical record, a lot of times the progress notes are in a SOAP format, and in the source-oriented medical records, a lot of times they're in a narrative format, but they can be in either format. So the two different types of progress notes. And in all cases, the most recent information appears first. So it goes in a reverse chronological order, and everything must be dated and initialed. It's important so that they know who took the notes and when the notes are from. So this is an example of a problem-oriented medical record excerpt where they, so this is left otitis media, that's an ear infection, and so there's a lot of abbreviations here, but it talks about the prescriptions, and it talks about different, now I can't remember what these are, CE, ear infection. Oh, the education that was provided, so the fact sheet that was given to the patient. Okay. Here's the acronyms here. DP is the diagnostic plan. So if there's a diagnostic plan, like tests needed to be ordered or something like that, then like in this case with the VTI, or maybe that says UTI, urinary tract infection, and maybe they needed to do a culture, a CNS is a culture and sensitivity, so that was a diagnostic plan. They needed to make sure that a UA is a urinalysis, so they needed to send the urine for urinalysis and a culture and sensitivity test, so that was part of the diagnostic plan. There was a prescription that was prescribed, and then the patient was given information, a fact sheet about UTIs. So it's all kind of different infections or diseases that this person had the different plans of treatment are all organized by the different illnesses. Oops, sorry, it's my phone in the background. When it comes to progress notes, there's a couple of different types. There's different styles, I guess you could say. So the different styles are narrative, SOAP notes, or charting by exception. So narrative notes are like they sound. They're more narrated. They are written in paragraph form, sometimes in bullet form, but like a story. They're more time consuming to record. They are more difficult to read because they're, longer, but they do provide a bit more context and information. These are a little bit more old school. The more common notes nowadays is the SOAP note style. So SOAP is an acronym. It stands for Subjective, Objective, Assessment, and Plan. And so in the S, subjective section, you are writing in the words of the patient what the patient is saying. So a patient comes in and says, my stomach hurts real bad. So you write down, patient's stomach hurts real bad. And then maybe the healthcare provider does an exam and does some palpation of the abdomen and notes, that there's some tenderness in the left upper quadrant. All right, so that's the objective impression of the examiner when the doctor does the exam. And then maybe they have an assessment, they have a diagnosis. Maybe they say, okay, that sounds like it might be, kidney pain or appendix pain. I don't know. I don't even remember which quadrant I said at this point. But they might give a diagnosis of appendicitis or a gastric ulcer based on those subjective and objective objective impressions. They may also need to get further tests done in order to confirm their assessment, their diagnosis, and they also may propose a treatment plan, which would also be part of the plan. So the plan would be, what tests are they ordering, what medications are they ordering, or what surgeries are they ordering. Charting by exception is sort of a fusion of the two. I'm actually not even going to go over it because I don't think it's very common anymore. But this is an example of it. Okay, so that's the end of my lecture on communication and documentation in healthcare.